Our mission, our drive is to drive behaviour change for consumers at scale and really have an impact on population health. Particularly, we focus on 4 key pillars of health to provide holistic support to our users. One is activity, one is sleep, one is nutrition, and the 4th is stress. And all those medically qualified on the call will know that they're core drivers of cardiac health. Through this collaboration, we would be able to enable patients to have a much better view of their health with the platforms at Apollo and ConnectedLife, and enable healthcare providers to have tools to make better, more timely interventions. And we're really looking forward to seeing how the collaboration rolls out in the future. And thank you for having us meet with you and the media today.
To give her address and tell us about the future that we are thinking together.
So good afternoon and namaste. It's a pleasure to be with all of you today. And clearly, this is a significant moment in the development and the evolution of a thought process that we all share. And that is that data, technology, and consumer centricity will transform the way we shape healthcare. The second very important point for us to focus on, the last 2.5, 3 years, the world has been focused on a pandemic. But the underlying pandemic of non-communicable disease is really the biggest area that we need to focus on and be worried. It is the world's largest killer. It is growing at the fastest rate possible. And more significantly, there is something we can do about it. Okay. So I think that this is one significant solution in a plethora of many initiatives that people are trying to handle one thing, and that is to keep the world, to keep population, to keep homes and individuals healthier. And because they are healthier, they are happier, and the incidence of major disease comes down. That's what we're trying to do here. So we're using technology, we're using data, we're using the science of tracking. Today's focus is a little bit about continuous data. It's about the creation of federated learning models, of modeling what is the implication of a certain data point into the immediate term and the long-term health of an individual, and translating this data into insights. And insights, not just theory, but actionable insights, which then get delivered back in real time to the individual so that these intelligent, educated consumers can take control of their own healthcare. That's what we're trying to do today. I'm very happy to be surrounded by these intelligent, fantastic people. Dr. Shivakumar, who's worked on this journey of the AICVD and took our 18 million records of the Apollo Health Check, of our population health, and worked with clinical teams, data scientists to convert it into the first risk score. I think Dr. Shivakumar's commitment to this has been fairly long-term in the history of evolution of AI, and he actually won the Innovation Prize at the US Cardiology Society way back in 2019. India recognized this as an important achievement, and he got the Best Innovation Award at the Cardiology Society of India. So he's been putting this forward. Dr. Sujoy has a clinical background, but the mind of an engineer. So his heart and mind are connected in finding ways to create this. And Darren, your focus on individual, but also on population health. Because the extent of the problem is so vast that administrators and health policy makers must figure out how to focus on the vulnerable. This focus on the vulnerable will happen by two aspects. One is by educating the entire society and by separating those at high risk for greater monitoring and intervention. And this is a technology to enable that, because it's easy to talk about screening, but it's not so easy to implement it unless you use new age tools. And that's where the power of Fitbit comes in. It is a very powerful initial monitoring and screening, which is wearable, which is continuous, which is a consumer product. So connecting that data into a health-evolved ecosystem like we have at Apollo or Alexandra Hospital and many other hospitals who are joining in and validating this. The combination and the partnership is going to help to create a safer, better world. This window of proof of concept of one aspect is going to open up the capability for us to do this in many, many more fields and many, many more realms. So I'm excited on multiple accounts. I'm hopeful about the learning, the partnership, the joint effort towards creating a healthier population, and the fact that there's a product already available today, so that we can go ahead and share this with people. Equally, our mobile app, Apollo 24/7, also incorporates this risk scoring. So whether you're using it on whichever medium, the only final message that I have to people, which I request the media, is please let individuals and populations become health aware, appreciate the underlying risk in the community of cancer, of cardiac ailments, of strokes, of all kinds of renal disorders, and the fact that most of them can be eliminated, and if you find them early, the treatment is easier and more cost effective. So this health awareness is really our biggest message, and using technology to enable it is our second message. So thank you all very much.
Thank you, ma'am. Thank you for this truly inspiration behind this entire program that we are running here at Apollo Hospitals. And this is now taking leaps and bounds, going to other nations, other countries, validating, using this in the prospective use. So
and thank you, Sujoy, if I may. I think I'm very excited that we can take a product which was first made in India, but is now available to get validated and used across the world. So India is very well known for our IT services prowess. It's also getting known for our clinical capability, but merging that and going with partners like Alexandra Hospital and others to say that we can create a global product to make global communities safer is really a source of great excitement. And so I thank you for that, Darryl.
And can I just say, I would thank you so much, ma'am. I'd just like to highlight that the team at ConnectedLife with Fitbit is at present managing the deployment of its solution with over 50 healthcare partners worldwide. So that's in the UK, that's in Spain, Italy, Indonesia, and of course in Singapore. And what's wonderful about this collaboration is that the Apollo Clinical AICD tool and the future tools will automatically be available and operational to customers, as hopefully I was illustrating through the demonstration. So in Singapore, the work that Dr. Alex and myself are doing with respect to Alexandra Hospital is really trying to prepare and trailblaze the widespread adoption and everyday application of the Apollo Clinical AI through the ConnectedLife application. And when we talk about national agendas, we really see that these collaboration with Apollo Hospitals is really furthering the application of clinical AI and helping countries like Singapore get healthier and achieve their national agendas, and just further emphasizing how easy to use smartphone technology, wearable technology is just enabling the ability to deliver this kind of capability at scale, at seriously low cost.
Brilliant points. Thank you so much, Mr. Darryl. I will now bring in Mr. Arvind Sivaramakrishnan, Group CIO, Apollo Hospitals. Mr. Arvind has been the Group CIO at Apollo Hospital and has been the front runner in the entire digital transformation and now the AI transformation within the organization. Over to you, sir, for the takeaway points and what that we are going to do in future.
Thank you, Dr. Sujoy, and absolute pleasure to be present. I think in this aspect of what we do can absolutely heartening that digital transformation active partnership with delivery of healthcare is actually real. And this is something that brings to light how we can reach the planet of 1 billion people effectively with the highest level of quality and with the clinical precision of the best clinical minds and the doctors and the clinicians that we have, not just in Apollo hospitals, but across the planet. It's really heartening to see that this is a culmination of bringing in Apollo's AI program, the entire program of AI, backed by its powerful digital strategy of how to manage and handle data and ensuring that the personalization of an individual in care delivery is done with the highest level of quality, service, and accuracy. This kind of brings to light that digital transformation is necessarily like the electricity that is going to power healthcare delivery. Like what Dr. Sangeeta Reddy was talking about, non-communicable diseases, individuals just staying healthy to ensure that we continue to enjoy good health, and above all, this kind of underscores that very aspect of Atmanirbharta, not just to oneself, to their commitment to their family, commitment to their society, and obviously commitment to a nation as such. Bringing in such like technological partnerships with ConnectedLife, with think Fitbit of Google, and bringing in clinical expertise from Apollo and Alexandra, make all this collaboration global and at the same time personalized and individual. So it's really heartening to see all of this coming together, and it's heartening to see that these will be available for use. Thank you to all the clinicians for helping the technology, and thank you to the technology for helping clinicians. Over to you, Sujit.
We are coming to an end of the individual speeches, addresses, and presentation. I would now request my friend Amir to open this now for question and answer sessions. We do have a hard stop in next 15-20 minutes, but we are there to take at least 3-4 questions in between that. So Amir, take it from here. Please help us coordinate the question and answer sessions.
Hi, good afternoon, everyone. Media colleagues, the forum is open for questions. Please raise your hand. We have a question from Suman Munshi.
First of all, thank you everyone for bringing such a wonderful technique. Am I audible?
Yes. Yes, thank you.
Yes. Yeah. Thanks to the India team. My question is, when you are collecting data,
Someone please state, please state your publication as well.
Suman Munshi from IVG News, General Secretary, All India Reporter Association. Okay, so the question is, what kind of data security you are taking care for the protecting the individual data, and what are the areas you are sharing the data with the third party or any other institutions? Thank you.
So I'm going to ask Arvind Sivaramakrishna to take this first and then over to Darren.
In terms of data security, Suman, we follow the ISO 27001 standards, which ensure the data is secure at the data center. This means that for doing all these insights, all data is completely anonymized. And this is anonymized only after the consent of the patient to participate in such like programs is undertaken.
Continue, Arvind, just to say that all data is de-identified.
All data is anonymized. That means the source and the personal identity of a patient is never revealed and can be interviewed. And partnerships are based only on clinical clinical and ethical approval of the clinicians understanding the purpose of what we are trying to analyze and thereby the sharing with institutions. That's really how the realm of privacy as well as the management of data works.
Please, David.
Thank you for the question, and if I can add. So, working hand in hand with the Singapore government, we have developed trusted, secure and scalable enterprise infrastructure with strict accountability for automating how data is and reporting how data is acquired, how it is used, and how privacy and protection controls are maintained. But critically, when we invoke the clinical AI from Apollo hospitals, we're bringing the AI to the data in the domain of the healthcare provider. What that means is we're able to generate the output, the results, without ever exposing any of the patient data that's safe and secure within the hospital provider to the Apollo system. So we've developed a new capability to enable advanced application of clinical AI for many without the data ever to move and be fully accountable for that. And it's a great privilege to be supporting this collaboration on this area.
Yeah, please go ahead.
I'd like to add to that. So one of the activities that we did with AI CBD was to get it validated in Maastricht population.
Correct.
And the way we actually did this was that we extended the API to a cloud server, where people could then call these APIs looking at the data at their hospital premises itself, residing in their own servers, residing in their own country, and therefore get the results and do computing on top of their data and get